Okay, this is an example of a regen medicine treatment that we do here at Pursuit. This example is for shoulder osteoarthritis, and he's already had his stem cell done. Now, depending on the physician and what they do with the stem cells, you don't start with PT right away. If it's a hemopoietic stem cell or a PRP injection, you're going to have to wait a week until you start therapy. If it's more of a fat adipose tissue stem cell, you have to wait 3 weeks before you start therapy. So there's certain parameters based off of the physician and the injection of what you get. But at some point, the best next thing to do is to help them stem cells, guide them on where to go and to not cause a flare-up. Okay, and that's where physiotherapy comes in. We can use the shockwave unit to help what I call is the stem cell party. So you just got a stem cell, whether it's PRP stem cells, really peptides, exosomes, anything. We have a stem cell party going on there. And what we want to do is help that party grow. So we want the stem cells to grow in peripherally. We want the stem cells to bring more stem cells coming in. So we want more stem cells to migrate to the area. We also want the stem cells to differentiate. Remember, a stem cell is a multipotent cell. We don't want it to stay as a stem cell. We want it to turn into a cartilage cell or a bone cell to fix the osteoarthritis here. And then we also want the stem cells to kind of migrate towards the site of injury so it fixes the actual problem. So what shockwave and what physiotherapy does after the stem cell injection is makes the stem cell party better. It keeps the party going. Because stem cells are going to keep working for months after the injection, even up to a year sometimes. So the purpose of therapy and using the shockwave after a stem cell injection is to really focus on keeping that party going, getting more people coming to the stem cell party and making it grow and making it better. So this is an example of shockwave treatment for shoulder osteoarthritis. We'll start here. And we're in a position that we have one of the top shockwave units that is strong enough to get to his shoulder joint. If I'm just shooting shockwave into his muscle, yeah, it's going to help with muscle stuff. But regarding a stem cell injection, I want the shockwave and the waves to get to the joint to cause that biogenic reaction. Not to get into dork stuff, but it's changing biogenic ways and different pathways that goes over all that stuff that I just went over about the stem cell party. During a shockwave treatment, you should feel a little ache, like a toothache, but this isn't a painful approach. This isn't something that you have to go through a lot of pain to get. So this is an example of a shockwave treatment that we do here with our stem cell regen medicine program. If you have any questions, you can just click on the link below or give us a phone call today at 407-494-8835 or visit us at pursuittherapy.com. Thanks.